Hello, my name is Jason Soukup. I'm a veterinary dentist and oral maxillofacial surgeon here at the University of Wisconsin School of Veterinary Medicine. An overview of what I do would be to take imaging studies like a CAT scan, CT, into a dedicated software where I can create 3D models of a patient's both head and pathology, the disease process itself. And then I use the three-dimensional models in a virtual environment within the software to perform the surgery, practice the surgery. And from there, I can print 3D models. And all of that is all to speed up the surgical procedure itself, rehearse it, and minimize complications. The dentistry and oral maxillofacial surgery service has extensive experience in complex maxillofacial procedures. We've been doing this for decades. However, over the last few years, we've started to utilize the technology of 3D modeling, virtual surgical planning, and 3D printing. Since we've started using this technology, we've executed somewhere in the neighborhood of 10 to 20 procedures utilizing this technology. This process of planning and executing a complex maxillofacial surgery starts with imaging. We gather a CAT scan of the patient's skull, which includes the pathology, the disease. Often it's a tumor, or it could be some trauma, a fractured jaw or maxilla bone. With that imaging, we get an opportunity to get a very detailed depiction of the disease process itself. And from that imaging, we can create three-dimensional models that we can use in our software and for printing. All right, so from here, we have a 3D model created in the software. The next step is to, in this case, where we're dealing with a tumor, is to perform the procedure virtually within the software, meaning I'm going to remove the tumor, cut out the tumor within the software itself. This is a way of planning and rehearsing the procedure. The end result is a skull that's had the tumor removed, and we then can use these three-dimensional computer models and print them on a three-dimensional printer. Those three-dimensional models can be used in our hands to study the approaches and utilize in surgery to help make sure that we stick within our margins, our original surgical plan. One of the things that we can do with the software is we can use the software to design cutting guides that allow us to make very, very precise cuts through bone. Here is an example of a case that required precision cuts. Over on the right is a case of a dog that had a tumor near the eye, and as you might imagine, some very critical structures in that area, including the eye itself. And over to the left is a software that's associated with this design software that allows us to create a surgical guide. Now, these surgical guides can then be printed on a 3D printer and used in the surgery to make very precise cuts. One of the great advantages of this computer modeling software we use and the 3D printing is if we have a patient that has, for example, a broken left jaw, we can actually in the software model the patient's right mandible, the opposite side, and then in the software we can create a mirror image of that opposite mandible so that it mimics the left side. And by doing that, we can then print that normal left mandible. And we can use this print, and by drawing the fracture lines on the print, we can then use the model to pre-contour some bone plates. By pre-contouring the bone plates, we have two advantages. One is that it speeds up the surgery time. Normally, the way this would be done is the bone plates would be contoured and matched to the bone in surgery, and that takes time. So by doing it ahead of time, we decrease the amount of time the patient's under anesthesia. But we also know that once it's pre-contoured and we put it on the bone in surgery, everything should be lined up just so. So it improves outcome, makes for a better outcome.